Hello students, we will show today a very specific instrument used for a specific procedure. Unlike general instrument like artery, ALIS, all this is very common instrument for all surgeries, minor to major. Here I am showing an instrument which is very specifically used for some one specific procedure as such, a selective instrument. So identify this instrument, what this specific instrument is. So look at that. So it has got a very stout curved area with a tip like a towel clip. It is tip which has got a lock here both side, and you got a screw here, rotating screw, threads. You can rotate it, widen it. When you do it like this, it get widened. So this area is important. So what is this instrument is? You might have seen this one. So this instrument is Jolls thyroid retractor, used specifically after raising the skin flap in thyroidectomy. Upper and lower flaps should be retracted well. You can use this instrument, very useful. Keep the flaps widely open so that you can undergo procedure in the deeper plane to open the deep fascia. Then if you want to cut the strap muscles and to dissect superior, middle pedicle, superior pedicle, inferior pedicle, to identify recurrent laryngeal nerve and parathyroid glands both sides, then of course remove the thyroid with the isthmus called as total thyroidectomy, or whatever the types if you want. If you want hemithyroidectomy, total thyroidectomy, this instrument is essential once you raise the skin flap. This is, remember the name, Jolls thyroid retractor, very useful instrument. If this instrument is not available, alternate way is to place sutures at different areas, upper to lower to the drape or skin above. You can place using the silk is the cutting needle, and at the end of the procedure you will cut this suture, then you can put the flap back. So to retract the flap, so instrument is ideal is this one actually. So what are the features? It is self-retaining thyroid retractor, not manual. So assistant's hands are free to help you, and raise the skin flaps upwards and downward to expose the deeper part for proper dissection. I have already told. So what are the uses? Again, it is specifically designed for thyroidectomy, applied after thyroid flap rise. I already told. So this specific instrument for thyroidectomy. So this is how exactly see that. It is the upper flap, this is the lower flap, you can see, and this is the blade, how exactly it is. This is the rotating. This you can rotate it, this you can rotate it. This area you can rotate it, and it widen whatever the way, how much you want, widens it, same thing it comes, and see that same thing. This is the diagram actually. Jolls thyroid retractor. This is the thyroid, dissected thyroid. You can see the additional retractor you can pass across that also. So this is Jolls self-retaining thyroid retractor, designed specifically for thyroidectomy to keep the upper and lower flaps in place, so that help the assistant to work on with you while proceeding with the thyroidectomy as such. So please students go through my SRB clinical methods in surgery with proper video lectures in detail about the clinical examination, current edition, and my manual, SRB's manual of surgery with all lectures, all topics, subject, theory subject, with the quotations in detail, with the illustrations, with the photos and case scenarios, and online MCQs connected to that. So it covers every topics as far as CBME syllabus. For PGs also it is helpful. It contains also specialties, basic specialties, urology, neurosurgery, cardiothoracic specialties, and it also covers operative surgery briefly, instrument, also X-rays a little bit, and other basic topics, essential topics also. Please go through my book, Operative Surgery in Detail 2 volume extensive book is also available for detailed procedure of even small minor procedure to ultra major procedures in general surgery, abdominal surgery, neck and thyroid surgeries, and so on. And skill operative book is how exactly to do suturing with the video lecture. That is also very useful. My digital lectures through JP is very popular, which is detailed surgery. All topics are covered with the detailed lectures, including clinical examination and operative surgery basic, instrument, X-rays, specimens, specialties, basics, everything. Please subscribe for 1 year and then near the exam. so that both UGs and PGs will be benefited very well with these DigiNeuro applications. So students, I hope this specific thyroid retractor Jolls you have understood very clearly. Thank you very much.